Hi guys, it's Grant from Grant Ford Fitness and Jets Caloundra, and today we're bringing you a quick video on the benefits of foam rolling, or SMR, self-myofascial release. We'll explain briefly what it does for you, and then I'll go through a quick routine that will be beneficial for most people before they train and after they train. So why do we use a foam roller? Basically, as if you listen to my video yesterday about the importance of movement, I talked about how your body fixes itself into positions. Certain muscles are used more than others, and because they're used more than others, they get shorter or tighter. Same is true if you're doing lots and lots of exercise and you're doing exercise in one direction or one particular exercise over and over again. The muscles that you're using get shorter and tighter. Again, the opposing muscles tend to get stretched and get pulled out of balance. Now, what the foam roller is very good for is any muscles that are short or tight, it restores their length to them. Yeah, so you're stretching out or flattening out and elongating the muscle tissue, which helps restore the balance at the joint. So for instance, if you're sitting down an awful lot, your hip flexors, or the things that cause your hips to bend, are on all the time, and the muscles at the back, your glutes, tend to get stretched, so they don't work as much. Now what this does, it pulls your skeleton out of balance. If you can add some length back into those hip flexors, it reduces the pull on your pelvis, and again your skeleton gets back into a better balanced position. The other problem with having tight muscles, it could seriously reduce your mobility. So if you're doing something like a squat pattern or a deadlift, you need to have good mobility at your ankle, your knees, and your hips. This is particularly true if you're doing Olympic lifts. Anything when you're doing a clean or a snatch, you need to have really good mobility through your ankle complex, your knee complex, and your hip complex, as well as having good thoracic extension and mobility through your shoulders. If you don't do any stretching or any foam rolling, you're going to find you're really, really tight, and you're going to find it difficult to get into the positions you need to perform lifts safely and well. Okay, so a foam roller is just a tool for restoring some length to your muscles. What we're going to do now is I'm going to go out and I'm going to talk you through a routine that I do before I train and after I train. If you see a PT, if you see a trainer, they will assess your posture and they can give you specific SMR foam rolling exercise you can do to address any imbalances you have. Otherwise, if you follow the routine that I'm about to talk you through, you'll notice some differences. You follow it for 5 or 6 weeks, you'll notice significant improvements in your mobility. Okay guys, here we go. We're going to start by rolling your calf muscles out. So start with the foam roller at the base of your calf muscle and raise your bum off the floor, support yourself with your hands, place your other leg over the top of the leg you're rolling, and then slowly roll along the length of the calf muscle, rotating from side to side, seeing if you find any knots. If you find any knots, what you're going to do is sit on the knot for 30 seconds to a minute until the pain eases off. If that's too painful, you can take your leg off the top of the leg that you're rolling to relieve the pressure, and if that's still too painful for you, you can sit your bum down on the floor and again just leave your leg like that. It's a good idea if you can get your body weight up to put as much pressure as you can on, but don't make it unbearable. Make sure you do both legs and roll the entire length of the calf. After doing your calves, we're going to move on to the adductor complex, or the inside of your thighs. So place the roller at 45 degrees from one of your knees in a kneeling position. Lie down with your hips flat on the floor and place the inside of the leg you're going to roll along the length of the roller. From the side, looks like this. Lie down, kink your knee out so it's rolling along the inside of your thigh, and then all you're going to do is roll along the length of the inside of your thigh from your groin down towards your knee, stopping just before you get to the knee joint. If you find any knots, you can just bend your leg to find the bit where it's the most painful, and same as with the calf, sit on the knot for 30 seconds to a minute until the pain starts to dissipate. Okay. Again here, if you keep your hips and your knees off the floor on the leg that you're supporting yourself with, the leg you're not rolling, it increases the pressure through your adductor. If you drop your knee and your hip down to the floor, it reduces the pressure. Again, just like with all the bits that you're going to foam roll, half of this is self-exploratory. You have to roll and find the bits that are sore and tender for you. Again, roll along the length of the muscle 4 or 5 times, really searching for any tightness, any knots. Each knot, sit on for that 30 seconds to a minute. Make sure you do both legs, and then we'll move on to the next bit. Following your adductors, we're going to move on to your quads and your hip flexors. So you're going to start lying face down with one leg on the roller, up close near your hip by your hip flexor. And all we're going to do, we're going to roll down away from your hip towards your knee joint. If you want to increase the pressure on your quad, cross your other leg over your heel on the leg that you're rolling, and again, this will increase the pressure through your quad. Same as with all the other muscles. As you roll down, you're nice and slowly and rotating from side to side to search out any knots. As you find your knots, you're just going to sit on them 30 seconds to a minute till they dissipate, and then move down the muscle. Okay. Again, give the muscle 4 or 5 passes to make sure that you're getting everything. And if you want to reduce the pressure, take your leg off, place it on the floor. If you want to increase it, cross your ankles. So after you finish with your both quads, you're then going to move on to your IT bands, which is just the length of tissue running down the outside of your thigh between your quad and your hamstring. All you can do is start up by your hip. Again, support yourself in a side plank position, one foot on top of the other, and one elbow on the ground, and just gently, slowly roll along the length of your IT band. Same as everything else, looking for tender spots, rolling your body backwards and forwards until you find the areas of tightness. Again, same deal, sick of me saying this by now, but 30 seconds to a minute on each hot spot. If the pain is too much, you can place your top leg on the floor to help support yourself, and you can also put your hand on the floor to support yourself. But as with all the others, the more pressure you can withstand, the quicker you're going to get through the knots. Okay, so just hold on them, breathe deeply, 30 seconds to a minute, move down the length of the IT band, and do both legs. From there, we're going to move on to the glutes. So start sitting on the roller. You're going to work one side at a time. Turn the roller so it's 45 degrees running across one glute. Cross that leg, that foot over the opposite knee, and lean back on the hand of the same side. Then just roll from the glute up towards the hip and back down again. If you're going to feel any discomfort, it will be as you approach the top of the glutes towards the hip bone. See it here from the side, do exactly the same thing, set up, cross your leg over, and as you get to around this area, if you're going to feel any discomfort, it will be there. The roller may not get in deep enough to have a good effect on you, so if you're not feeling too much discomfort on the roller, I recommend sitting on a tennis ball or a lacrosse ball. Start with a tennis ball because it's a little bit softer. Same deal, cross your leg over and sit and roll until you find a hot spot. Each hot spot 30 seconds to a minute, and go through the whole area and then do the opposite side. From there, we're going to move on to your thoracic spine. You're going to set the roller up so it's running across your spine, just below your shoulder blades. You're going to keep your lower back neutral so you're not arching through your lower back, and support your head with your hands and just let gravity roll your shoulders backwards. You can take 5 or 6 deep breaths when you're in this position. Each time you breathe out, you're looking to go a little bit lower, get a little bit closer to the ground. After you've done your 5 or 6 breaths, you can sit up, move the roller a little bit further down your spine, and repeat the process. Again, do 2 or 3 spots. Just don't move the roller too far down your back, and don't let the roller get towards your lower back at any point. From there, we're just going to move into our lat. So you're going to roll onto your side with your arm extended out as in the video. You're going to start with the roller just under your armpit, and you're going to roll down towards the bottom of your lat. So just halfway along your rib cage, and then roll back up. Same with all the others. You're going to rotate back and forwards, see if you can find any hot spots. Make sure you roll through the whole lat muscle, then you're going to turn over, repeat this on the other side. And the final thing you're going to roll is your pecs. So this time you're going to lie face down with the arm again extended out in front of you. You're going to place the roller so it's running 45 degrees from your pec down towards your sternum. See it again from this angle, face down, and just roll from the armpit down towards the center of your chest, looking for any hot spots. Same deal, rest on them for 30 to 60 seconds and run through the muscle 4 or 5 times. And there you have it, guys. That is my all over body foam roller before and after training. Give it a go and see how your mobility increases.